All right, so wound care doctor update. No, I haven't gone to one, and here's why. And if you love a good American healthcare rant, then stick around. So I was given when I went to the emergency room the second time, a referral, which I don't need with my insurance, but I figure it's good to have the documentation that I do need this doctor, for a wound care doctor who is associated. It's like a wound care center, and they are associated with the hospital. Excuse me. So all of my ER documentation, paperwork, everything that went down, my 2 ER visits would just be in the system for this doctor. And I wouldn't have to, re-explain everything and bring paperwork and all that good stuff. So we called them on last Friday, not knowing they closed at 1, and we called at like 1:45. So called again on Monday, and after 7 phone calls, finally reached a person. Kept getting voicemails. And this wound care center treats a lot of different reasons to go to a wound care doctor. After you have open heart surgery, they check the incision, diabetes wounds, amputations, things like that. So they have a lot of different doctors there, dermatologists, oncologists, or like orthopedic, you name it, they got it. So the person there said, let me see which of the doctors take your insurance, please hold. And went through like 20 something doctors, and not one of them take my insurance. So Monday evening then, we went online to our insurance and said, okay, what wound care centers or doctors are covered? And my insurance does not cover wound care centers or doctors. It's not a part of the plan. And when you are purchasing your plan, there are some doctors you look for, and you look for the coverage of things like deductibles and co-pays. But at least for us, we never dreamt of seeing if wound care centers and doctors were going to be covered, because we didn't ever foresee that need. Lesson learned? I don't know. It feels like such a niche thing to have thought of. Anyway, so then yesterday, my husband is the main name on our insurance, and also I will make phone calls about anybody and everybody. But when it comes to myself, especially medical stuff, my anxiety is through the roof, and I will probably have a panic attack while on the phone. So for those 2 reasons, my husband called our insurance and spoke to somebody. And let me just get my bearings while I relay this conversation. Hang on. Okay, so my husband relayed to the individual with the insurance company everything I just said. She needs this doctor. The doctor's not on the plan. What do we do? So the person with the insurance said, well, you can go to a primary care and see what to do. And my husband said, well, we're having trouble finding a primary care who's like taking new patients, who's in the vicinity, etc. But also we know where she needs to go, meaning me. We know where I need to go. We know who the next step is. That's not the point. So then the person goes, well, why don't you just pick a different specialist to go to? She doesn't need referrals. And again, my husband goes, but we know who we need to see. And why would we just, close our eyes and pick a specialist and hope they will take care of this? Because chances are they would say, I don't deal with this. You should see a wound care specialist. So she goes, well, then go to your primary. Like, it was this like back and forth ping pong. Go to your primary, or just, pick a different, physician specialist to see about it. And my husband goes, it's an infected wound, abscess, MRSA. We know the ER doctor who saw her twice said it's a wound care specialist that's next. That's who to see for this. There's no need for us to question that. So opened up an appeal to say, we need to see a doctor of this kind who's not covered on the plan. Hey, we even have a place who's recommended because it was documented that I was in the ER, blah, blah, blah. And we should hopefully know by Friday if we are approved to see a wound care doctor and if it will be this place who is in conjunction with the hospital. And it literally goes before a panel of people. Probably very few who have medical experience. There might be like a doctor on there. But right now I'm at the mercy of a panel if I get to see the doctor I need to see. And if they don't approve it, I just got a low battery notice. If they don't approve it, then we're going to call the ER nurse hotline and say, who's the next best physician to see, if not a wound care specialist, for this problem. And hope that if I do have to see a different specialist, they take on my case and don't say go to a wound care, because I can't potentially. So that's scary and frustrating, because meanwhile, while this is healing, I still have a cyst that needs to be taken care of. And it's just scary to know what you need and you're not allowed to get that help. It's pretty scary to think about. I try not to dwell on it, but it's hard not to, as we just await the verdict. So yeah, but everybody has been so kind, you know, on any video I post, sending well wishes, doing check-ins, and I really appreciate that. And I'm sorry that my page has just become cyst talk. I don't want it to be that way. So yeah, but I appreciate everyone checking in and asking how I'm doing. I don't know, I'm tired. This morning I took my last dose of my antibiotic, which is scary because the ER doctor wanted me to see a wound care specialist before my antibiotics were up, and I won't. So that's scary also. But I'm healing, but I really just don't know what the next step is. Like, I know what the next step should be. I just don't know if that's what it will be. All right. I hope y'all are doing okay. We're almost done with this week. I'll talk to you later.